afternoon, everyone. My name is Natasha Salem, and I am the founder of Empowering Women with Tech, and I am your host today for this incredible event launching Liria Digital Health, its actual release here in the Digital Festival. I am so honoured to be asked to host this event. I founded Empowering Women with Tech 4 years ago to elevate, encourage and inspire more females to get into the digital science and tech industry, but also to succeed in the industry. And one of the things that we did is we set up a mentoring scheme because we believed in the power of conversations and mentors in further developing females to succeed in the industry. And I got an application through a while ago from this amazing woman called Erica, who was a pharmacist wanting to get into digital and actively looking for a mentor to help her traverse what the sector is, the opportunities for her, how she could sidestep into the industry. And it took me a bit of time to find someone. And this incredible woman called Leanne Potter was the person that I felt would be best to mentor her. Leanne herself is someone who has sidestepped into the industry from being a photographer, going to coding courses, and eventually getting a job at the NHS, specializing in cybersecurity. She's now gone on from strength to strength and gone to Conveyor Insurance. And I felt that the pairing would be great as somebody who had gone on this squiggly career path into digital, paired with somebody who was wanting to do the same thing. And lo and behold, the relationship took off, and I hear that they are about to set up their own startup in Femtech, solving some of the challenges that we have around underrepresentation and underreporting, and starting with a big taboo topic which needs attention, which is the menopause. So I am incredibly proud of the pair of them, and so proud that they are here to share their story and hopefully get a number of you joining them on their journey launching this tech startup. So without further ado, we have a wonderful video that Liria Digital Health want to play to explain a little bit about their journey so far and what they're hoping to launch. Roll VT.
In 2015, an archivist in America was working on a historical digitization project. And it was a lot of things like documents from the county hall's office, written in that outlandish scrawl that we associate with times gone by, lots of legal documents, the occasional amusing news story. One in particular I really liked was about this rogue turkey that went around terrorizing the townsfolk in Thanksgiving. And with their white gloves on, this archivist, started pulling documents from the top of the pile, bringing them down, scanning them in, bringing them down and scanning them in. And they came across this one, and it had big scrawling handwriting on it. And it was this big, huge sheet, and it was all torn and worn around the edges, all yellow, just like a treasure map. And it said on it, 1889, reasons for admission into the Trans-Allegheny Lunatic Asylum. This is a bit more of an interesting piece of social history, this archivist thought. So they started reading through it, and it seemed like it was a list for why women had been put into this institution over the years. So they read on, and it was things like melancholy, death of a child, hearing voices, murder, the kind of things you would sort of expect people to be incarcerated for. And then they read on, and it was things like political excitement, overtaxing mental powers, overaction of the mind. It's always really dangerous, that. I always try and avoid that. Imaginary female trouble, female design, woman trouble, masturbation for 30 years, derange masturbation. Actually, this masturbation was mentioned like 5 times in this document, so I'm not sure who was more obsessed with it, the women or the people who were putting the women away for it. But my favorite one was absolutely some disturbing behavior. And I'm so glad that there was men out there to put women away for this, because it was just horrific. And that was novel reading. Absolutely disgusting, shocking behavior. So it's really good thing that, someone put their foot down and said, let's put these women away for that. And we can laugh at this because, that was the 1800s, modern society knows better. We don't do anything like that now, do we? And then you start looking into it a bit further. During the 1940s and 50s, there was this new medical advancement. It was the darling of the scientific community. It was going to be a cure-all for mental illness. It was the lobotomy, and it was going to be scientists' way of mastering the brain for their more difficult and less understood elements of human behaviour. Unfortunately, that seemed to translate to actually being women's behaviour, because it seems like during that time, when it was at its most popular during the 40s and 50s, that actually 60 to 72% of women were the ones that the surgery was performed on. And often it was because of things like, they're too boisterous, they're too strong-willed, or they didn't conform to a Stepford wives ideal. So they were sent off to be cured with lobotomy. I even heard about this one case where this woman, she went to go see a doctor and she was being abused by her husband, and he said, well, I'll just send you to get lobotomized so you can cope with it better. And again, we think, well, that's 70 years ago, Leanne, come on. It's not barely living memory, calm down, We know better now, for sure we know better now. But did you know that only 20% of the medical research that is done today is done on the female body? In a world where drugs for easing period pains, drugs aimed at increasing female libido, so the female Viagra, are all tested on men. You've got to wonder, do we really know any better? And when you think of people, if I say to you, imagine someone having a heart attack, what do you see? You see perhaps an overweight bloke, middle-aged, clutching his heart, tingly arm. But did you actually know that it's actually women who are more likely to have heart attacks than men? And their misdiagnosis has absolutely fatal consequences. So do we really know better nowadays when the top cardiologists today, when interviewed, reveal that they're unaware that women have completely different symptoms to men when it comes to having a heart attack? We might not be locking women up for novel reading these days, but we're still a very long way from understanding the female body. And it's because of underfunding, under-research, and quite frankly, a lack of interest. Women's health is classed as a niche field, and it's costing us greatly.
Now, Leanne, let's bring it to modern day. Thankfully, women aren't being locked up for novel reading. As we also have audiobooks, I love a good audiobook. Even with conditions like the menopause, something that impacts every single person with a womb, and arguably not niche, the very people who are supposed to help us don't want to deal with us. Now, I was speaking with a commissioner at my local CCG who used to be a practice manager, and she shared that the GP at the time delayed giving women the results of the blood test results to find out if they were going through the menopause. He kept putting the test results back to the back of the pile. Now, just because he just didn't want to deal with these women. Now, women tend to present GPs quite emotional, understandably so. They just often seek solace, looking for solutions for their symptoms. They just want to be able to cope better through this change. Okay, so some people would argue that the menopause is hard to diagnose, right? You've got to test for menopause, right? Okay. Well, what about the medically induced menopause, either from cancer symptoms, cancer treatment, or hysterectomy? Because we know having a hysterectomy is guaranteed to put you into early menopause. And we should at least tell these women that by the very nature of having this drastic reduction of estrogen, which is literally applying the brakes like an emergency stop when previously you've been going at 100 miles an hour, that when this procedure happens, the menopause symptoms are deemed to be more drastic. You have worse symptoms than people that tend to go through natural menopause. I can sort of relate to this because I had 2 children. Both my labours were certainly not equal. My first labour had to be induced, and oh my goodness, it was like my contractions went from 10 to infinity. And I almost had out of good experience thinking, oh my goodness, I'm going to die. My second labour, however, was a lot more different because the body, adjusted, knew this was coming up and thought, let's get this over quick. And the body had time to adjust, much to my husband's delight, because I wasn't grabbing onto his hand for dear life and the blood supply swiftly came back. Now, surely when women go through this change, we should at least tell them how to cope. support them through this change, perhaps. Now, one of the fondest memories, one of the last memories I had of my mum was when we went to Thailand 4 years ago. And at the age of 49, she had a hysterectomy. And I would have assumed at the time that they'd have told her, look, you know, had a hysterectomy, you are likely to be having menopause a lot earlier, and your symptoms will be a bit more intense. So just to be aware of that, and should you ever have the inkling whereby, you know, coping very well, go to your doctor, you know, and seek some sort of treatment. But she never did. She never went to the GP, not once. Now, in her early 50s to mid 50s, she decided to look for supplements because she just kept on complaining, I'm just feeling quite tired, drained, fatigued. And I remember on many occasions, she will be sweating profusely like buckets and, you know, just turn up the drop of a hat, whether it was hot or cold, or just literally was pouring off her, which was obvious. I knew these were hot flashes. Now, and also, she didn't really sleep very well. She would be snapping at the most odd times, and she would experience a bit of loss of memory, which we just thought, mum, just be mum, you know, as she should do sometimes. Now, something didn't dawn on me in terms when we started holding the focus groups. When women were sharing their stories about, you know, feeling quite low, quite lethargic, feeling a bit anxious, related to depression and so forth. And then the light bulb went off. I thought, my goodness. As a healthcare professional, never did I realise that those additional symptoms related to mental health could be attributed to the menopause. I had missed it. I had missed an opportunity to really be there for my mum. And I remember calling my dad and saying, Dad, and he just couldn't say a word. It was almost like it was silent. That moment was almost lasted forever. And that was really painful to realise. This is a much bigger problem. It needs solving, and we are the ones to do it. Our company, Liria Digital Health, is a health tech company like no other. We care about niche. We care about you having the knowledge to live your life to be better.
Because the fact of the matter is, for as long as women are seen as too difficult to cater for, these problems will persist. And a doctor I admired once sort of said to me, people talk about vaginas like they're really badly designed, but they're actually just really poorly maintained, and there's not enough mechanics who are skilled to do so. But in a world that's as technologically advanced as we are, some health conditions will, and some people in society will, be seen as too difficult to cater for. And we need to use technology to create bespoke experiences that fit people as individuals, not as an approximation of what a group of developers, who are often, in my experience, you know, white middle-class males, think that life is like for these women. And when you think of like your phone, like how different is it to when you used it about 5 years ago? You expect so much more from your phone, but in return, you actually want to put less into it. So if you go to a website, for example, you're thinking of a shop, you type it in, you just want to type in the name. You don't want to just be taken to the website though. Down the right-hand side, you expect to see the shop opening times, but not just any shop opening times, not just the generic ones, the shop opening times that are local to you. You expect all that information to come to you with very, very little input. And our expectations for a bespoke experience in tech has never been stronger. And you think about how individual you make it, you know, you change the background photo on your phone, you know, you choose the apps, you know, when in technology, you know, 20 years ago, you choose what you actually want on that computer, someone else doesn't decide. And as much as you might find it creepy, you actually do quite like being advertised things you might be interested in, because it's a lot better to be advertised something you're interested in. But what strikes us at Liria Digital is that same move towards a unique and bespoke and individual experience has not materialized in health tech. And it all boils down to a lack of research, a lack of funding, and a lack of interest. And people will tell you it's because there's just too many variables, you know, the human body, there's just too many variables. But we say that you shouldn't halt progress for the betterment of people's health just because some people are too hard to study, non-conformist, or not worthy of study, classed as niche. And we're the ones to bridge this gap. And we're more than a health tech development company. We provide people with the tools to create, innovate, and empower. We want to be the place that people come to when they have under-researched, forgotten, or unloved health conditions. Our customers are not just our customers, they're going to be our co-creators, and we're going to work collaboratively with them. They're going to create the innovative technological solutions, and we're going to give them the tools and the support to unleash this passion to innovate, create, challenge, and change the lives of millions of people, using technology in a collective endeavour, striving towards a better health for all. And we give our customers the freedom to live their lives as individuals, not as health conditions. And they lead us, not the other way around, in this journey to create unbeatable user experiences in health tech adoption for them, by them. We envision a future in Liria Digital where a trans person can come to us and tell us they've had a really difficult time managing their dosage for their hormone replacement therapies, but they've got an idea for an app, and that'll make people's lives better. It'll make people manage better. It'll make people be better. We will help them get their idea into the hands of people that need it.
We have a vision to empower people to become experts in their own health and well-being. And we'll do this through tech incubating on the behalf of others so they don't have to start from scratch and waste precious time. They'll get the health tech innovations out to the people that really need it. And we'll also create our own in-house products, like our first product, which will be the menopause app. So how do we achieve this? By listening, by holding more focus groups, listen to stories, listen to your story. Our mantra is simple: to seek first to understand our customers, then the innovations will follow.
And it's through these stories and our lack of awareness for a condition that will inevitably impact us. Nobody tells you about the menopause when you're in your 30s. Nobody tells you in primary school. Nobody tells you these things. That's why we decided we'll focus on the menopause. And it'll be an app that fosters better collaboration and communication with GPs, because this is the area we've highlighted that needs work. We want people going through the menopause to get the help they need without ever needing to come back in 6 months when you've got more evidence. And we will empower them to understand their bodies. We will educate them so that they can act and so that they can feel less alone. Knowledge is power, and knowledge gives people the power to question, which is crucial. It gives people the power to demand better, to be experts in their own health, and to shout out when something's not right. We will give them a community to laugh, share, cry, and grow.
Now, from the various focus groups that we've done, there was one story that really stuck in my mind, and there were plenty, there were loads. It was from a 58-year-old woman. She used to be a ward sister, and she's now retired, and she said, I used to run a ward. Now I feel I can't even look after myself. How sad is that? This is a huge social impact of women just leaving the workplace because simply they just feel that they can't cope. We know that health is wealth. A woman going through this change, it doesn't only impact her health, but it affects her self-confidence, her self-esteem, her self-worth, which it stops her from pursuing certain career paths. And that's not right. Not only are there social implications, there are also implications like prescribing costs, healthcare costs, because often women will present at the GP on many of occasions and they'll be sent through a batch of tests. We see this time and time again. It's almost like guesswork. What's wrong with my patient? Until the GP, who's really aware to understand, have an inkling, thinking, could this be the menopause? Could it be? And we understand that GPs can't know everything. You know, they're general practitioners, and you know, women's health is an expert area which needs to be really focused and to be made a priority. The sad thing is, obviously, women's health isn't a priority. We appreciate this knowledge is very broad, and we know that GPs with special interest, we need to make this their focus. We know that women also from ethnic minorities and low socioeconomic backgrounds are less likely to seek medical help and resources just due to a lack of confidence in their ability to understand how to manage this difficult period in their lives. The thing is, every woman will go through this experience in the future. There's a whole range of symptoms, and some people may get off quite lightly. But on the other side, some people can experience really debilitating symptoms. As I mentioned, my mum went through a whole host of symptoms because she had an induced menopause. In the focus groups, lots of different things were just coming up time and time again. I want to be acknowledged. I just want to be listened to.
We are the people to turn these stories into action. We are Liria Digital. Liria Digital is what you get when you get two incredibly passionate people who join the tech industry, not for the hardware, not for the software, not for the $1 billion valuation. Not going to turn that down when that happens, but because of a genuine desire to do tech for good. Liria Digital is what you get when you have an anthropologist who specialized in digital inclusion, but wanted to be more hands-on, joined the tech industry so that they could design tech that's more accessible and reach as many people as possible. So they became a software developer at the NHS. And then that person who wasn't able to quite shake people before technology became fascinated by how cyber criminals were utilizing behavioral science to make people engage in risky behavior, pivoted again, and then became a cybersecurity evangelist so that the data we share doesn't go in the wrong hands. Liria Digital is what you get when you've been working on the front line for 15 years as a pharmacist, developing a deep understanding about symptoms and conditions that can be sometimes too embarrassing to discuss. It's what you get when you see the dots connect with the data and the experiences that people are going through in a way that nobody else seems to do. It's what you get when you have someone that really cares, but more than that, has the drive, the ambition to see it through. Liria Digital is what you get when two people come together after looking at what's already out there and going, there must be a better way. We're not going to wait for Silicon Valley to build something that doesn't meet our needs. We demand better, you should demand better, and we will help you create better. Liria Digital cares so much about the person that we are so invested that it's you over the technology, that we will design our products, unlike every other technology product that's out there, to be non-addictive. If your phone is in your pocket more than your hand to help you with your health and well-being, then we've done our job. We want our innovations to be able to enable you to enjoy living your life in that moment. Our health products are not a tool. Our health products are a tool, not a lifestyle.
We have grand ambitions. We envisage our innovations in the form of products and services to be available and accessible to the people that really need them. Our innovations will simply make our customers' lives better. We're an international company. This is reflected by the diverse panel we have from all over the world for this here today.
So what do we need from you? Well, we're looking to expand the team. We're in the process of creating a pilot study, and this will put our technology in the hands of about 50,000 women to start with. And then that will hopefully spread across England, and then we'll move it to international markets. We are moving very fast, and we need to grow very fast. We'll be advertising these roles formally, but in the meantime, if you want to find us on LinkedIn, get in touch and we'll happily hear your story. We're also looking to fund our minimum viable product, which is the menopause app that we've been discussing. As I say, we've had loads of interest from women, but also from other clinicians and other people in health tech who want this product to come to market. Our commissioners are waiting for us to deliver. With investment, we will deliver.
We need more research, we need more stories, we need your stories. You support us by coming to this launch, and we're so thankful and grateful for that. You're already on that journey with us. The time is now. We are the people to bring about this revolution. Join us, we need you. We are here to disrupt the health tech industry.
We are here to change the world. Liria Digital Health. Demand better. Thank you for joining us.
Thank you.
That was absolutely incredible. I hope that everybody realised the sincerity from these two founders in this sector. What I would say is, if you're inspired with what you're hearing at the moment, please make some noise on social media. The hashtag is Liria Launch, Liria Launch. We have Liria Digital on Twitter. And if you'd like to ask any of our panelists or Leanne or Erica some questions, we're on Slido with the password of 90236. So we're about to go into a panel in a second, but I wanted to just make some comments on what these two amazing founders have discussed. So to bring it into context, in September 2015, the McKinsey Global Institute reported that advancing women's equality can add 12 trillion to global growth. The report argued that if women do not achieve their full economic potential, the global economy will suffer. You know, Femtech is still such a tiny sector. The vaping startup Juul, for example, attracts more capital than the whole of Femtech as a category, but it's growing and you'll see a lot more male than female investors, and that's having an impact on a firm's investment choices. And, you know, for me, I'm really interested in technologies that are around healthier lives, a fairer society, and a more sustainable planet. And I think that Femtech could easily touch on each of these things. So without further ado, what I wanted to do is move on to a discussion panel. There is an app for that, the individual versus the health tech industry. So the health tech industry shows no sign of slowing down. So what can industry leaders do to ensure that people can find a Femtech health tech solution that meets their needs in a world full of apps? We're going to have a discussion where we discuss the future of Femtech health tech and what this means for better health outcomes for all of us with our panelists from around the world. So I'm very, very excited to introduce Sarah Seedig, Sheena D. Franklin, Kristen Asker, and Liria Digital. So ladies, if you'd like to join me on the panel right now. With the power
Hello.
Hello, Kristen. So thank you so much for joining us for this really exciting Liria Digital Health launch. So I would just love if all of you could just do a little 2-minute introduction to who you are and what you do.
Yeah, I think I'm going to start. So first of all, I'd like to thank you for putting together this great event on this very important and actual topic and for inviting me. It's a great pleasure and also privilege to be discussing health tech among these inspiring women. And I hope that it's going to lead to an insightful discussion. As mentioned, my name is Sarah, and I have recently founded Sexploratory Issues, a research and insights platform that seeks to bridge health information gaps, as well as to provide insights into innovative technologies surrounding women's sexual and reproductive health. But I'm also a social scientist, also an anthropologist by training, and most of my research has addressed social issues and socioeconomic disparities surrounding women's health in the East African context. And yeah, I'm currently doing a PhD on the potential as well as the challenges in regards to Femtech with a specific focus on emerging markets as well.
Lovely, thank you, Sarah.
Hello, everyone. I'm Sheena Franklin, and while it's morning here, I will say good afternoon to you all there. And I am the founder of Well Kept Beauty, and our first product is Kept Health. And what we do is we take the human expertise from dermatologists and we combine that with AI and machine learning to provide holistic or integrative dermatology methods with culturally competent practitioners as well. And we provide traditional dermatology services, but we do that using at-home skin health monitoring, private chat sessions, as well as virtual visits using store and forward technology that decreases the barriers of cultural competency, as well as the need for scheduling visits. Our primary mission is to really be able to use dermatology as it is a patient-centric, consumer-driven specialty to address health equity gaps. And I'm really looking forward to the conversation, and I'm excited to be on the panel with such great women.
Brilliant, thank you, Sheena. Kristen?
Hi, yes. Hi, I'm Kristen. I'm the head of design or chief design officer at Endometrics, and Endometrics is a company founded in the belief of I don't know if any of you have heard, but there's this disease called endometriosis. I happen to be an endo warrior or an endometriosis patient myself. And the company was founded based on women shouldn't have to suffer through pain and be misbelieved by doctors and go through life with this disease, which is extremely common, 1 in 10 worldwide, as the statistics say today. So I joined them, and we are working towards helping women communicate with their doctors and trying to change the healthcare industry from the patient's, like starting with the patient's perspective, but starting from within, kind of. So I'm super glad to be part of this conversation and be part of this talk with all of you. It's going to be amazing. I'm so excited.
Wonderful. So I've got loads of questions, so I'm going to start straight off. So health tech seems to be on a lot of people's agenda lately. Perhaps it's because of a result of COVID-19, which has meant technology adoption has been at pace for those who would not normally use technology to access health services. So in a world where there is seemingly an app for everything, what elements do you think technology companies are doing well and maybe not so well in this space? So I'm going to go to Sarah first on this.
Yeah, thank you. Well, to begin with, I do think that COVID-19 has pushed people on the space, but also outside of it, to think more about remote solutions and technical innovation that allows us to stay connected, to be informed, but also to feel cared for during these challenging times. I think that it is something that tech companies are doing well with at the moment. The ecosystem has acknowledged the need and value of these products, but I do think there is still room for improvement and that we are just in the very beginning of this exciting chapter. I think that innovators, and with that I mean entrepreneurs as well as VCs, have shifted their focus to healthcare solutions that are more inclusive and easier to access and more affordable, which is probably partly due to the market insights that have shown that female technology, for example, is considered an untapped market full of opportunities to tap into. However, I would personally wish that we would get closer to the bottom of addressing the gender gap in technology, which really needs to be eradicated from the sector.
No, that's great. Kristen, what's your take on this?
I do think that COVID has had a role or played a role in the entire healthcare tech becoming more relevant, because I think people are becoming more aware of how fragile society is in regards to how your health is impacted by other people's, which I think is good. Although I would say that in my own experience, and the reason why I joined and wanted to continue working, even though I'm sick and basically been hospitalized for the past month in and out, is because the current solutions, although very they're aiming to do very good things, aren't really meeting the standards of the patients. They're not asking the questions, and they're not designed based on what the patient actually needs. And that's something that I've been reoccurringly faced with when it comes to for example, tracking menstruation or something like that. I think many of the companies creating those types of apps today, as we're talking about the gender gap, they're driven by men who maybe doesn't face the issues that women do face within their menstruation. And I think we could bring a lot more user-centered design to the table, and that's what I hope that we will do. I think there's a huge market for us to build onto, but I think we should do it with the user and the patient, or the person rather, as the focus. And then also thinking about how just because something is digital doesn't mean that it's accessible. Yes, it's more accessible for people with disabilities like myself. I have many different ones, not only endometriosis. But for example, with dyslexia is a huge issue for a lot of people, and just because there's text online doesn't mean that that's accessible. People who are blind need text-to-speech and other things that we need to think about. And I think that's also part of the user-centered focus. We need to listen to our users and make sure that it's for everyone and not only for the status quo, and it's just satisfying the largest amount of consumers.
Yeah, absolutely. And Sheena, picking up on what Kristen was talking about, you know, do you have a feeling that there are potentially is a risk of leaving people behind if they're unable with digital literacy or to afford technology or afford, modern devices? Is that a fear for you as a founder?
It definitely is. And that's one of the areas I feel that a founder in digital health can actually improve overall healthcare and the healthcare system. So when we talk about a platform being affordable and accessible, we really need to look at what does that mean? You know, most of the digital products today, whether they are focused on the general market or even towards women, they are affordable to a certain type of woman, right? So you leave the individuals out who actually really need that integrative care. So that's asking me about my personal life, my lifestyle, not just looking at me as a patient. So as a founder, we really have to look at the whole person's cultural experience. Why is someone not going to the doctor? Why am I not, communicating with my doctor? And how do we actually market these products? How do we getting them in the hands of the individuals who need them? And that's a big area that my team works on consistently, daily, in making sure that we're hitting all the points that we need to.
Brilliant. And then throwing it to Leanne and Erica, obviously you're going into this space because you feel that there is opportunity to do things a lot better. So which companies, in this space do you admire already?
There's a lot of great work being doing in sort of the Femtech industry, and there's what I've really enjoyed seeing is not only that their products are actually amazing, but actually their ethos behind their company is amazing as well. So there's companies like Clue, for example, who do amazing things, for menstruation. But also when you hear about their company values as well, so their female staff can take time off if they're having particularly bad periods. And it's just like little things like that. So I think not only will more women coming in and being sort of health tech founders, not only will that mean better products out there, but I also think it will actually make better companies that are out there. And it'll give women more choice to actually choose careers in tech, where, we will consider if they're having a bad day with, really bad period cramps. We will consider if they've got childcare issues. We will consider that they want part-time hours. These are the problems that are fundamentally impacting the technology industry anyways. But these companies that, want to address a need that's not been addressed before are also addressing a social company-wide need as well, because they've just got people who want to do good things and who also want to drive really good company behaviors.
And I think there's probably a separate panel we could explore around access to funding as well. Like I mentioned, there is a vaping startup that gains more investment than the whole of the femtech sector combined. And that probably speaks volumes about, the makeup and the diversity of investment capitalist companies and venture capitalist companies as well. So
yeah. So when I've had, just to bring up on that point, when I've had a conversation, for example, I had one recently with a gentleman who was an investor, but I came to him just for sort of advice. And he kept saying that our product was a feminine hygiene product. And I kept having to correct him, saying it's not a feminine hygiene product, but they just couldn't get over that fact. So it's about coming up to the right people and being able to say that right message as well, which is quite difficult in this arena.
No, absolutely. So kind of moving on from that, we hear about the big players in the health tech industry consistently forgetting about women or failing to design products that don't consider, let's say, female physiology or female life experiences. So, for example, when Apple released its health app in 2014, you could track seemingly everything except menstruation, which, to caveat, has since been corrected. Why do you think female health has been neglected in health tech so far? And I'll probably throw that first to Kristen.
Oh, yeah, I have lots of thoughts on that, especially, but I think it's it's an issue based in how the product itself has been designed and who is designing the product, and partly their education and partly their practices within the company. I think one of the issues could be that maybe everyone hired there to the team might be male and might not be thinking about that perspective, the female perspective, I guess. Another issue could also be that when doing user research, if that's even done, which is from an interaction design perspective, rather a new thing, and like you would rather do a focus group than a user research study, and there's a big difference in that. And if they are done, usually companies do them with finding people who are like the people creating the product as well. So there could be an issue in who you're recruiting for these studies as well. You're not getting a wide enough perspective, and therefore things like this fall through the cracks, which is kind of insane to me, because like women make up, I guess, 50% or more of the population. So how but yeah, I think that's how it happens.
Yeah, no, absolutely. And I suppose, Leanne, Erica, do we think it's, down to the wider diversity or known diversity issues that we have in the sector with, less than 20% of females working in the sector? Do you think that plays a big role?
I think it plays a massive role. Myself, I have come from a market background, and I to go through there wasn't much diversity, and it was really heavy male dominated. So how can you then innovate products and services when you're not really including as many people that will be actually using those services? It just seems really bizarre. So inevitably, if you're going to design or innovate a particular product and you're not really having those values, inclusivity and diversity at its core, how can you then create something that's going to serve the people that really need it? So yes, Natasha, I think that's the main key, really.
Can I just, sorry.
Then yeah, please.
Yeah, I think you're completely right, Erica. And it made me think of what you were talking about, made me think of how inclusivity around disability is extremely low as well. And just think of how hard it is for someone who's physically disabled to access certain places in the world just because the person who built a building didn't think of the person in the wheelchair or who's walking with a walker, that they might need a ramp, for example. A simple solution could have helped lots of people access a service, but since the perspective isn't lived or isn't either like asked or what is it called, advised on, some things like this are hugely missed.
And going to Sheena and to Sarah, is there a concern about the fact we refer to a lot of this stuff as Femtech, that we're almost kind of creating this as a niche or a marginal thing? And picking up on Kristen's point, 51% of the population are female. And, is there a fear that by calling it Femtech and kind of giving it a sort of niche term, we're almost marginalizing it rather than kind of being a lot more bullish and going, do you know what, we don't need to be calling it Femtech because we should have been at the table sooner?
I think you're addressing a very important point here. I personally find it absolutely striking that Femtech is still being discussed as niche market. I mean, when really it is a market addressing needs of half of the world's population, right? There are many discussions around whether Femtech is a very sexist term. And I do believe there are those two sides to it. On one hand, you have Femtech as a market that needs to have that extra light on, and it needs to have that secure place and people and the ecosystem supporting each other and becoming visible as a strong market. And on the other hand, we shouldn't detach it entirely from digital health or telemedicine or med health or medtech in general. I think that's very important to find a balance between those two opinions.
Yes, I will add that there's two components to it. So if you look at it from the standpoint of the patient or the consumer, femtech is definitely a phrase that a woman is going to gravitate towards. However, when it comes to what we were talking about a little bit earlier about fundraising, when you niche it down, it's very difficult for an investor to understand the market opportunity. So I think that is where the push and pull comes in, saying, you know, I'm in the health tech industry and we're treating this particular disease and it has this particular market and this is who it affects. So when you start to talk about the fintech industry as just its own area, it does become a little bit niche, quote unquote, in regards to a broader health tech market. And I think that you have to have that balance. So maybe it's going back and forth depending on who your audience is.
I also would like to pinpoint to the more structural problem behind it, right? Because when we're talking about inequalities, we do have to take into account who is forming the discourse around health and health tech and who is having an impact on what is being addressed. And then as well, what we addressed earlier is also to ask who is bringing the resources and the means to such a discourse. But we have to look at it, I think, also from a more holistic perspective to really understand who is forming the discourse around it and also to open up our own discourse. I mean, it's great to have this panel here, but we also need to be able to, open the discourse to the broader health tech industry.
And I think you make a really valuable point there, Sarah, because I remember, being told by a researcher, well, we can't include females because the menstrual cycle will interfere with the results, which I just found outstanding. That's basically saying reality is too complicated for me to engage with, but reality will exist whether you engage with it or not. The menstrual cycle doesn't cease to exist because you don't test it. It just means you won't know what the effects are before what we use, whatever it is you're testing. And the other thing that people often say is, well, we'll start off in men, and if we find anything interesting, we'll add women at a later date, which is also a really good example of how we think of the male body as a neutral, universal body, and the female body as the complicated factor. The thing that's frustrating for me is there are things that will work for women that won't work for men. So if you start off just in men and only proceed in women, if you find anything interesting, there's things you'll rule out at an early stage just because it wouldn't have worked on, it would have worked just for women. We need to be starting off our testing at the cell level of male and female cells and not just using male cells as if they're the universal template. So kind of picking up on that discussion, in the work that you do, what is the key motivation when it comes to better health outcomes? So Leanne and Erica, what is your kind of key motivation that will, help you to help, this underrepresented audience?
I think when we were setting this company up, one thing that we just kept coming back to, and I work in the industry, I was a software developer, now work in cybersecurity, but I'm definitely not the type of person who, even though I love the industry, I don't see tech as the be all and end all. And I think the danger is that some of these companies do see the tech first and forget about it's actually people holding these phones is as a person, it's a human being. It's it's not another robot talking to another robot. So they don't design with that in mind. They miss the fundamentality of what a thing could be because they take out the person straight away and they just focus on the tech. So when we were sort of discussing ideas for this organization, we were just like, I hate the fact that a notification will bump up and I'll have to stop whatever I'm doing, and I'll just be like, okay, did someone like a comment that I made? Why is no one else liking this? Why is, and you would just be sucked into it. And, that alert that comes up, you've spent, 4 hours today looking at your phone. We did not want that. So our motivation was like, can we do this from a different perspective? Can we do this, come up about this in another way? Can we give people the information that they want, the ability to track the information that they want without having them to be constantly glued to their phones? Just so that we can make it a tool rather than a soft crux.
Yeah, no, absolutely. So Sheena, with Well Kept Beauty, what was the thing that motivated you to really drive your startup?
Yeah, so it's a couple of things. One, we really try to get people to understand that skincare is skin health. So being that your skin is your largest organ, everything that we experience is shown through our skin. And that's really important. So what we found out in our early pilot is that individuals, women, were taking their apps to them, not just to their dermatologist, not just to the esthetician, they were taking it to their chemotherapy sessions to talk to the nurse. Why is my skin burning? You're not helping me. This is what I'm doing. Taking it to their gynecologist, taking it to their primary care physician, understanding what's going on with my skin. Yes, you told me I have this about menopause, but it's really taking to account the holistic and integrative approach, not just to dermatology, but healthcare overall. So that's what drove me after having my own experience, but also just listening to the women who are already engaging with us.
Yes, no, absolutely. And Kristen, you talked, what is an incredibly personal journey for you going into endometrix. So, what do you hope, in 5 to 10 years will be some of the outcomes in that area for you?
I hope that me and other women won't ever again have to go to the doctors and be scared of the outcome of if they're going to be listened to, believed, if they're going to be called or basically ignored, called like dumb or that you don't know what you're talking about. That women don't have to lose trust in doctors, and that we will receive a more holistic healthcare, a healthcare industry that is actually taking into account that my body is an entire thing, and all of the symptoms, all of the things that I go through, if it's menopause or endometriosis, or if it's a joint issue or skin like psoriasis or something like that, all of that affects the rest of the body. It's not an isolated event, just like Leanne talked about with menstruation. It's everything is going to affect each other. So I can't go to only one doctor and talk to my gynecologist, for example, and only talk to them about my endometriosis. It's only also going to impact my dietary needs and what my bowels look like and what experience that have, or what I have from that. There's so many things. So that's, I guess I have a very lofty big goal, but I hope that at least a woman can go and feel secure in this is my experience. I know what I'm talking about. And if they are being met with ignorance, then they can stand up for themselves and be sure to find a new doctor if that happens, but also to make sure that that doctor knows what they did wrong. Yeah.
No, and I really appreciate you sharing that with us. As unfortunately, I think most females who are watching this or taking part in this will have an account of where they haven't been believed or they've been challenged, and they've told the truth, they've explained how they're feeling, and had doctors or clinicians disagree or doubt their symptoms. And I suppose, Sarah, picking up on some of these incredibly important themes, do you think that the Femtech revolution that we're hopefully seeing is this ability for women to actually be believed and to change the narrative that potentially, academics and clinicians have been, advised to consult against?
Well, if I draw a very dystopian picture, I would say it's not enough to have those products. So I really agree with what Leanne also told us earlier. It's about taking the human experience into account and taking into account that there are people behind those technologies and that there are people engaging and socially interacting with technology. So at Exploratory Issues, for example, our key motivation is to share data-based information, but mainly deriving from qualitative research and not only quantitative research. So to inform both women as well as people in the space about those sexual and reproductive health issues and also societal issues surrounding it. Because menstruation as such can be discussed in a biological way, but it can also be discussed in a societal way, right? And then we hope that we somehow can bridge these information gaps and advise on how innovation and technology can actually impact women's lives. And I personally believe that by being able to provide better health outcomes, we as a collective in the world can also make it a more meaningful and equal and inclusive place to live at. And I think that also overcoming these health disparities and hindrances is especially crucial for developing countries. And this is something that we have to address and work towards as a collective.
Yeah, no, absolutely. And just building on Leanne's point, you know, when it comes to health tech, who should be the drivers? Should it be clinicians? Should it be academia and scientists, health tech companies, the government, or the consumers? How do you find that balance, and where should the drivers be? So Sarah, starting with you.
Yeah, well, similar to what I just said, I think it's a collective effort, and I think that the process should be reciprocal. So I think that we should all build on each other's knowledge and inform each other, so that in the end, social and health research endeavors such as Sexplo could work closely with other scientists and clinicians who can then inform health tech companies, and those companies could be, for example, supported by the government to build these creative and really amazing products for consumers. And then in return, the consumers could inform those research and insights platforms again, and to give them and provide them data, and they're super valuable qualitative data, and also suggestions on how to improve it.
Brilliant. Before I just go on to the rest of the panelists, after this panel session, we're going to go into a Q&A with Leanne and Erica, the founders of Liria Health Digital. So if you have any questions that you would like me to present to them, please use the Q&A here on Zoom, or send it on Slido or on the socials, and I will ask them afterwards. So taking that same question about who should be the drivers to the decisions in health tech, going to Leanne and Erica, where do you feel that that balance should be? So, you know, with the clinicians, with the health tech professionals, and with the consumers.
Yeah, so it definitely is a collaborative approach, and you know, our values is really that our customers are our co-creators. That's key to us. We really want to understand our customers, so therefore we understand them, we're able to innovate, and you know, that will distill into products and services. But also the clinicians, particularly the primary care healthcare providers, they need to really have an in-depth understanding of what their patients, especially relates to women's health. And it may not just be a particular GP, maybe a GP in a locality would have a special interest whereby should a woman present with women's health symptoms, if a GP is not comfortable or it's not an interest of theirs, then perhaps they could be referred to a GP that has this interest. Therefore, these consultations could be more productive, and the customer or the woman feels understood and feels heard. So I think it's definitely a collaborative approach. When it comes more to the healthcare, I think it's co-creation. You know, the customer, i.e. the patients, and also the GPs primarily. Yeah.
Kristen and Sheena, would you agree with that too?
Where do you want to start? Yeah.
Oh,
Go.
I'll go. Yeah, thanks, Kristen. So I definitely think, you know, it is a group effort. However, I will argue the point that I believe if you had a patient who created a platform, that platform is going to be more patient-centric. And for that founder, all of us on this panel, then you reach out to the specialists, whether it is a GP, whether it is a gynecologist, whether it is a dermatologist who has this integrative approach to care. That then creates this leadership team that's more aware of cultural competence. So that's not just race and gender. It goes back to what we were talking about before. You go into your doctor and you feel as though you're being gaslit, what you're experiencing. And so from there, you then take this approach to your patient customers, if you will, and you're asking them, what is their experience. So then you create a journey within your app that mirrors or makes that experience that they're having a lot better, because what you'll find is customers understand, or patients understand their condition, their problems, more than they understand what's available to them. So I think I will argue that when you have a founder who is a patient who experienced this on that side of the healthcare system, it's going to be a lot more powerful.
Yeah, I completely agree with you, Sheena. And what I was going to say is no amount of reading and studying is going to give you the same level of understanding compared to the lived experience. So therefore, I think the person and the patient in this regard is the one who should inform the future of any product or any type of design, just because you cannot understand the level of intersectionality between different types of issues, like disability or disease or race or other types of issues. There are things that I as a person don't understand at all, and I need to ask others. But I also think that in a collaboration, I think the users, I think what I hope at least with tech is that, or that's what I hope to build, or that we hope to build at Endometrics, is a platform not only to inform the user, the patient, of how they're managing their symptoms, but eventually that same data, anonymized, of course, and secure, because data security is a whole, no, sorry, let's not go into that one, because I'm going to go on a rant for that. But basically, I'm hoping that that same data generated across hundreds of women is going to inform academia, and then in turn inform doctors and healthcare providers, so that they can provide the best types of treatments, and we can do more accurate research and do more accurate studies and suggest more accurate treatment options, not only for women, but for anyone. So yeah, lived experience, I guess, is my answer.
Yes, absolutely. And I suppose that's the key to all innovations, right? Is having empathy for a specific situation. We have so many questions that we wanted to ask, but unfortunately our time is up. So I want everyone to give a virtual round of applause to our panel, who've been absolutely tremendous. So thank you, ladies, for joining us this afternoon.
Thank
you. Thank you for inviting us.
Yes, thank you.
So right now I have some questions actually for Leanne and Erica, if that's okay, that have come in from the wonderful people who are joining us right now. So Sally Craig asks, I have a question regarding the menopause system tracking app. Does this app information help GPs prescribe the correct type of HRT to their patients? I was prescribed HRT, which didn't relieve my symptoms after 6 months, and so discontinued.
So one of the innovations we're trying to do is there's a plethora of HRT treatments out there, patches, gel and so forth, and really want to focus down and kind of distill the data which we receive from our patients and inform the GP, so they're able to invite the patient in for consultation. Now at that point, the GP then can make the decision whether, if they feel that their clinical expertise doesn't really match what the symptoms which the patient is presenting with, therefore they'll be signposted to a healthcare specialist. Now, with the app, we would have all this information, so therefore we're speaking to and talks with gynae specialists to really inform this decision, to really get all this information within the app. We envisage it to be almost like a self-diagnostic tool to also empower the GP and also the patient. So it's almost like a two-way system. It is a complicated process because we really want to get it right. But in answer to the question, the answer would be simply, we draw on different specialities to distill this down.
Brilliant.
The idea is that instead of, like you said, you were told to come back in 6 months and check it out, what this app will enable you to do is, because we'll be the app is aimed to be in direct contact with your GP who take part in this. You know, there'll be touch points, so you will get a notification at some point, and but not constantly, because we don't want to be constantly bombarding you, but you'll get a notification point maybe a month or two in, and it'll say, how are you finding things? How are you finding this latest dosage? And you'll be able to rate that and say, oh, okay, this much, that much. And then that information can go back to your GP, and your GP can say, well, do you want to come in? Rather than leave it 6 months, do you want to come in? Or do you want to do a video call about it? Because, it's all going telehealth now. So there'll be that option there. So what we aim to do is you're not sat around waiting to build up this big body of evidence, or to sort of wait until, it's been too long and you've had to suffer for ages. It's about getting the results a lot faster, a lot quicker, and building that communication line.
Brilliant. And so we have another question that's come in to say, will you be looking to recruit menopause specialists onto your team?
We'd love it. Please get in touch.
That was nice and succinct. Okay. So Kristen asks, can I also ask a question? I want to ask if the app has any input from women who are going through chemical menopause due to endometriosis, or as a treatment option for any other disease or reason.
Yeah, so that's something when we've sort of had our focus groups. It's actually, when we've done our focus groups, we just invite people, we say, this is the field we're interested in, and people come in. And then we were quite, I suppose naively, when we were first starting this, quite astounded how many women actually have chemical menopause, or medically induced menopause. And we were finding that regardless of how wide a net we sort of threw this, there'd be 2 people on a call, out of say 20 people, or there'd be 2 people on the call that have gone through this, and it's just not discussed. And Erica, as she said earlier, has got her own personal story, so Erica could probably pick up on this, but because of the sort of personal element of what Erica's mum went through with her, medically induced menopause, it is very much a priority for us. We built this product for our mums.
Yeah, pretty much. And friends and family, one of my closest friends, she had a hysterectomy beginning of this year. And astoundingly, she wasn't pulled up. And so when she started experiencing rehabilitating symptoms, she went to the GP and also had to beg for HRT. It wasn't really part of the follow-up. And that really is, I think it's a travesty, whereby, you have to go through the whole process of going through the surgery, which is, quite a painful procedure, having to recover. And then you start this really heavy system whereby you drastic reduction in estrogen, and you're now going through the chemical menopause. Then you're just left alone just to get on with it, and that's not right. So yeah, we definitely want more stories. We want to really ensure that we include as many people, indeed, as Kristen said, that have gone through this process.
Yeah, and Tam said, my GP told me HRT does more harm than good, so I'm in a bit of a dilemma. Given antidepressants to help with hot flushes. So I think it's I suppose with Liria Digital Health, giving people an informed choice and an informed opinion on what the options are available to them, what treatment options are, because I suppose GP by its very essence, it's general practice. It is a general approach. And, we're all unique. We all have potentially unique symptoms. And so giving people, a space where they're listened to and have ideas of what avenues they can pursue, right?
Yeah, very much so. And just coming back to that, and I will caveat greatly that I am not a clinician, so I can't advise. But what we do know is that a lot of GPs are afraid to prescribe HRT due to a very historic study on HRT. And that HRT study has since been debunked. And is actually, if you look on NICE guidelines, so please do check out the NICE guidelines on menopause and take that to your GP. Don't suffer in silence. And again, I'm not a clinician, but also there has been studies to show that antidepressants do not solve menopause. And that's one of the issues that we find, is that people have been put on antidepressants. They are not depressed. It's a drop of estrogen. So please check out the NICE guidelines and do find information, and please don't be afraid to challenge your GP. It's not because, they don't care. They do care. They just haven't got the time. They've got so much to deal with, especially now. If you come just that little bit informed, which is what our app is aiming to do, please look up those guidance. Please don't suffer in silence with this.
Yes, no, absolutely. So I would want a lovely comment from Helen saying, I would like to say it's been incredibly amazing listening to you all. I've been through PCOS and endometriosis. The pain was unbearable. It took a lot of appointments to get to the final end of having a hysterectomy. This was my choice. I'm so happy this process will be streamlined.
Awesome.
So Emma asks, one of the legacies of the poorer health outcomes that have been highlighted by COVID is a lack of engagement and for potentially areas like traditional mental health support by the ethnic community, lack of representation in the mental health professionals via the employee assistance program has been identified. What are your thoughts of creating apps directed at specific demographics?
Yes, so when we're conducting these focus groups, we know from the data which we received and from the stories that women from ethnic minorities don't really present with the GPs for treatment, in particular the menopause which are focused on, but also other conditions. And I was speaking with a menopause specialist, and she was presenting to a group of women from a diverse ethnic minorities, and she presented them and said, "Are you ladies not going through the menopause? And you've listed all these different symptoms," and they just didn't say anything. They are going through them, but it's a culture. The culture aspect really plays key, because it's almost you just get on with it. You don't really complain. You don't talk much about how you're feeling. And even with my mum, when we used to go to the GP, and I think she was suffering with anemia one point, and she went and she really kind of dumbed down and said, "So mum, just tell the GP how you're feeling. Just almost has to be the spokesperson." And it just goes back to culture. So yes, we definitely. The plan is to get as many specialist input, but also when we hold these focus groups, we know that there's a lot of groups that don't really present with these symptoms. That's where the focus groups are really key. That, you know, our call to action is please do get in touch. You know, our plans are to hold more focus groups from diverse backgrounds, include as many people as possible.
Brilliant. We've had a lot of interest from people wanting to get involved with Liria Digital, which is amazing to see on your launch event. So for those who've got in touch and said that they'd love to be part of this wonderful journey, if you can reach out to the ladies at liriadigital.com, Liria digital.com, and they're at Liria Digital on Twitter as well. So what are you looking forward to most with Liria Digital?
I think for me, you know, we have all these ideas, and you know what we're looking forward to is actually having this product in the hands of the people that really need it, and just simply just making their lives better. That's, you know, the plan, and that's what we're looking forward to. So the process of, you know, developing an MVP, and we know it's a process. We want it to be iterative. We want to get it right. We understand it's a process, but that would really make us happy, as cliche as it is, that, you know, we had this idea, this, you know, grand idea, and now it's materialized and people actually using it and it's making their lives better.